How are you supposed to choose your plastic surgeon? Who knows what they're doing? Who's the right person? More specifically, how do you choose the best breast surgeon? That's exactly what I'm going to tell you today. Here we go. Hey guys, and welcome back to Boobdoc. I'm Dr. Z. If you have any interest in breast surgery, augmentation, lifts, reductions, or you just love boobs, you're going to want to subscribe to this channel and hit that notification bell so you don't miss a thing. Today I'd like to talk to you about something that's super important, yet rarely is discussed. How exactly do you pick your doctor? Usually it's by word of mouth, a referral, a friend or family member who had surgery done by that physician and had a pretty good experience. Sometimes it's by marketing, sometimes it's by just a simple web search, and whoever comes up first or who has the best reviews online ends up getting your business. But there's way more to it than that. So what's the right way to choose who gets to do your plastic surgery, whether it's breasts or anything else? In addition, what's the right way to choose any doctor? Well, I've come up with 5 key things that will help you determine who's the best surgeon for you. When it comes to plastic surgery, you absolutely have to be board certified. There's some doctors who will say they're well qualified, they've done the training, and they just didn't pass the test, or they didn't feel like passing the test. Baloney. They didn't pass because they didn't meet certain criteria, tough criteria, to get board certification. Board certification specifically in plastic and reconstructive surgery means a few different things. Number 1, that you have completed a very vigorous accredited surgical training program in plastic surgery. Number 2, that you have practiced for at least a year and accumulated a number of cases in the field of plastic surgery that you can defend during a board certification process. Number 3, that you've passed both a written and super tough, vigorous oral exam that only a certain few percentage of the applicants will pass every year. A lot of smart doctors out there don't pass their boards. It's not because they're not smart or because they're not technically skilled. It's because they didn't meet the specific criteria that the American Board of Plastic Surgery has put together to sort of quantify who has got the complete skill set needed to continue in the field with the moniker board certification and give some reassurance to patients searching for a qualified doctor. Oh, by the way, yes, I'm board certified. And make sure that they're board certified in plastic and reconstructive surgery, not family medicine or dentistry or dermatology. Those aren't bad fields, but if you want a plastic surgeon, you should get a plastic surgeon, not someone who claims to be a plastic surgeon, who never really completed a surgical residency in that field. Number 2 on my list is that the physician operates in an accredited facility. What does that mean? An accredited surgical facility means that the place where they operate has met certain criteria, just as a residency training program and certification means that you've met certain criteria. Your facility in this case is the one that's being graded and certified. It could be through JACO, or the Joint Commission, Quad ASF, which is the American Association for the Accreditation of Ambulatory Surgical Facilities. That's what I've got. And AAAHC, which is the Association for the Accreditation of Ambulatory Healthcare. All 3 of these are very legitimate and fine choices when you're looking for a place to have your plastic surgery. Just make sure to ask after you've determined whether or not your surgeon is board certified by the American Board of Plastic Surgery. Number 2, is your surgical facility accredited, and by whom? Like I mentioned, a lot of these criteria overlap with, in general, picking a surgeon. More specifically now about breast surgery or any other subspecialization, you want to ask your doctor, is this your specific subspecialty? Do you specialize in breast surgery? Do you specialize in breast augmentation? There's even subspecializations of the subspecialty. I'm a general plastic surgeon. I subspecialize in cosmetic breast surgery. I also perform other procedures more frequently than some. I do a lot of breast augmentation, I do a lot of breast reduction, I do a lot of breast lifting, and these three things all sort of work together in a general knowledge for cosmetic breast surgery. But believe it or not, there's plastic surgeons who specialize in nipple reconstruction. Not a lot of them focus on nipple reconstruction, but that's kind of like what they're known for. Or breast reconstruction using autologous tissue, which is your body's own tissue, to recreate a breast. So what's your subspecialization? And what makes you say so? Is it the number of procedures you performed? Is it just your interest in that? Have you published papers or done significant research in that field? All good questions that you can ask your surgeon directly or do some research online when you're trying to determine who's going to be the specialist for you. Some people might balk at this and say, if you're a plastic surgeon, you've trained in everything and you should be good to do anything. Sort of true, but not really, and I'm talking honestly now. I was trained in just about everything in the field of plastic surgery, and that includes not just cosmetics, but all the reconstructive things. Burn surgery, pediatric, craniofacial, hand, microvascular surgery. There's tons of stuff in plastic surgery from head to toe. And that's awesome. That's what I love about the field. But you have to kind of end up specializing in certain things that interest you the most, or that has the most demand in your area and what you end up having to do a lot of. I haven't done a cleft lip repair since my residency, and although I could still work my way through it and remember how to do it and figure out how to put the pieces back together, I certainly wouldn't want my child to have a cleft lip repair by someone like me, someone who hasn't done it in 10 years. You want to go somewhere that specializes, because that means they do it every day, all the time. They understand not just the latest techniques and are very proficient at it, but they are efficient. There's no fumbling, there's no wasting time, and they know how to treat all the potential complications because they've seen it all. And trust me, when it comes to breast surgery, I have seen it all. Kind of along those same lines, the fourth thing I would recommend is asking to see before and after photos. All surgeons don't have before and after photos, especially in fields like general surgery, where it's not naturally part of documenting what you have done. However, plastic surgery is a very visual field, and absolutely when it comes to cosmetics, you want to see the surgeon's body of work, not just to determine whether or not they're good or qualified, more so to show that they have an abundance of results to show you. There's tons of before and after photos demonstrating their experience and their proficiency, and also to look at the quality. Some people come to me and they say, I really chose you because I looked at your entire online photo gallery and I loved the way you closed your incision, or I love the overall natural look of your breast augmentation patients, or etc., etc. And others might not choose me because they prefer the certain look or style or method of doing a procedure that another surgeon uses, and that's totally fine. That's why we put them out there, to find patients who are a good match with us and vice versa. So make sure to look at those photos, and no longer is there a little album in the waiting room of the plastic surgeon. There might be some like that out there, but really it's all digital and online. So look for those online photo galleries while you're researching who you want to choose and before making that final decision. And there could be a phenomenal plastic surgeon who does impeccable work and is super proficient and has a lot of patients but doesn't have a good photo gallery to show you. That's possible. But if they don't take the time and the effort to really organize their work and show it in a way that is accessible to prospective patients in today's age, it's kind of tough to rationalize that. And the last criterion that I can leave with you on picking your breast surgeon is personality. Hey, how you doing? Not that kind of personality, but do you mesh? It's an important intangible quality that you need to look at whenever you're choosing someone to interact with, whether it's professionally, personally, any kind of physician interaction. You want to find someone that you feel comfortable with. If they're going to be cutting on you, if they're going to be taking care of you in the most intimate of ways and making sure that you heal properly and that they see you through all the way to the end until you're 100% satisfied, that's going to take a relationship built on trust, but also on likability. I know a plastic surgeon who happens to also be a lawyer, and his advice to me was never operate on a patient that you don't like. And we mean first impressions. That's kind of tough. I mean, I don't know if I've really heeded his advice fully, but the wisdom behind that is that you'll do the best job if you feel a connection with a patient, and we'd like to think that we do the best job on every single patient, and you do, technically you do. But if you really think about it, if you have a patient that you really like and that you really get along with, you're going to probably return their emails a little bit faster, their phone calls a little bit quicker, their requests to come in and be seen a little bit sooner than the patient that just drives you nuts because they're negative, they maybe are just a different personality, maybe they're just difficult overall. You still will take care of that patient, of course. That's the ethical thing to do, and that's what we're sworn to do, and we do it. But I think the experience, the patient and the physician experience overall will be a lot more satisfying and successful if it's a good fit. That's probably not the most important criterion of the 5 that I've given you, but it is something that is important. And if you go and see a few different doctors for recommendations or consultations, most of the time you should come away with a general feeling of who is the best for you. Not because of only the credentials and their photos and their recommendations and the word of mouth and all that. Definitely not because of their price alone. Because you don't want to save a few $100 when it comes to your body, your breasts, your face. But personality and the intangible feeling that not just the doctor, but also the entire staff, the practice, the environment, the receptionist, all the people involved in the team that will be taking care of you, give you a feeling that is warm, welcoming, but more than anything, a good fit. And that's hard to quantify, but you know it when you feel it. So that's it. My 5 suggestions to help you select your cosmetic breast surgeon. And as I've said, there's many more, and if you'd like to hear more, I could certainly put together another video with another 5 or 10. Or ask in the comments section below and I'll answer you anything you have regarding picking a surgeon or breast surgery in general. As always, thanks a lot for joining. I'm Dr. Z, and I appreciate you being a part of the Boobdoc Nation. Boobdoc fans, see the link in the comments section below to find out how you can get your own feel-good t-shirt and support breast health and cancer research.